Yeah, thank you.
Yeah. So with chin and jawline, few things which I would want to say because these are not included in this. So chin, basically Indian patients, we have, the horizontal thirds, only the lower third is something which we can do slight modifications, We cannot change the upper one third. We cannot much do in the middle one third. Only the lower third, that is because of the chin elongation and width we can manipulate so that the horizontal thirds we are talking about. So chin and jawline is the only area in the horizontal thirds when we consider is where we can work. And in Indian patients, the lowest one third is deficient. We have small chins. Caucasians and
Yeah,
other faces, they're long faces. So their lower thirds,
yeah,
but if you see Chinese, if you see Asians, this side, we have deficient lower face. The lower one third is deficient, right? So which is
yeah.
why chin and jawline is something we are always asking for, chin and jawline, chin and jawline. Everybody wants jawlines, right? So that is why it is becoming more important. Now, second important thing is that among all the bones in the face, the mandible is the one which is changing for entire, during entire span of your life.
Yeah.
So that is why one of my patients, she was there, she's like, I'll get, implants done. So I told her that implants is not something because is not an option for aesthetic fillers, implants are for some individual like who has, gone some accident or they have broken their jaw. In that case, okay, other than implant, there is no option. But for aesthetic reasons, implants is not advised because because mandible is ever changing, it's ever evolving. So,
Yeah.
which is why for aesthetic purposes only, uh,
Yeah.
it's always better to have fillers done.
You mean to say the results with implants are not that good
No,
aesthetically?
results are good. Results are good. But the only problem is that the mandible is changing. At times it is increasing in height, at times it is receding. So the life of implant is maximum, I think, 10 years.
Yeah, 10
Other,
years.
then you need to rework over it.
Yeah, you have to change it.
Change it. And also the implant with implants, that natural, I don't think the lower face becomes as natural as it would with fillers because fillers are more
Okay,
fluid.
fine. Yeah, okay.
And this area, the lower face is hypermobile, it is the most
Yeah,
mobile area of the face. It is the most, ever evolving, changing bony structure in this area. So here we need something which is fluid, flexible, movable,
yeah,
at the same time can help with adding some structure.
yeah, fine.
So the points for chin are first is C1, which is the mental crease or labiomental crease.
Yes.
हेलो भैया बाहर से ही कर दो आज गाड़ी साफ. So first is the mental crease, then second is the chin apex.
Yeah, chin apex.
C3 is anterior chin.
Anterior chin means these
The
2 points or these 2 points?
2 points. These two.
These. Oh, so anterior means the most projecting part of the chin?
Yes, the most projecting part of the chin. Right? Then C4 is the submental. It's just beneath the C2. C2, if we are injecting, we are going anteriorly. And if C4 we are injecting, we are going inferiorly.
Yes.
Right? Then C5 is the lateral chin. It is just in line with the, just medial to the marionette line. So C5 is a point, like from the oral commissions, if you draw a straight vertical line, that is C5.
Yeah.
That is in men. In women, you draw a line from the nasal area straight downwards, that is C5. So in C5, in men and women, it's slightly different.
So in men, it is the marionette lines.
No, in men, it is the vertical lines dropped from the oral commissure. This is
Vertical line. And in females?
vertical line drawn nasal ala.
Okay, nasal. So that's narrower in females.
So in women, it is narrower. In men, it is broader. Fine. So C5 and C6 is the pre-jowl sulcus. That is the base. Pre-jowl sulcus is the point where marionette lines end. This is C6 pre-jowl. Fine.
Yeah.
Any confusion there?
So in males, it is from the oral commissures down. Is it right?
Yeah.
In female, it is from the ala down.
Ala down, yeah. Because in female, the chin is more pointed. And in men, it is little broader as compared to men. Some people take it from the mid-pupillary line also, but this I find more, workable. Because oral commissures are, if we do it with respect to oral commissures, then it is one unit only,
Okay, got it.
So in women, they say like medial canthus, down the medial canthus like this. So it's same as nasal ala. Like
Yes,
nose is
fine.
very broad, then you can take the medial canthus, intercanthal distance in women.
Yeah. So my one question is, when we say MD code the number C1, C2, C3, does it mean that when we are giving fillers, we go like first we give to C1, then go to C2, then
Yes,
go to
that is
C3?
the sequence. That is the sequence you have to follow. Like you do C1, then you check C2. If it is required, inject. If not, then go to C3. If it is
Yeah.
required, inject. If not, then go to C4. So it is not that it is must to inject before doing the next point, but you have to assess it before doing the next point.
Yeah. So I mean the numbers are the sequence in which we should be going about
Yes.
ideally when we do the fillers. Is it right?
Exactly. Yeah, it's right, but not in case of lips. Lips, I told you, like, it's different.
Okay. Lips, this numbering is not valid.
Yeah,
But
it's not valid for Indian patients. For Caucasians, it might be. But for our
yeah,
population, I don't think it works.
practice.
Right?
In mid-phase, the numbering is valid, I think,
Yes,
because we always start
absolutely.
with CK1, we go to CK2, and then we come to CK3. So
Right.
in mid-phase, it is valid,
Yeah.
but in lips, it is not valid, and chin again, it is valid.
Yes. Although if you take training from Allergan, lips also, they'll be, saying the same sequence. But then the doctor will say, okay, this is what the Allergan is saying, but this is how you do it.
Fine. Okay.
Right?
Yeah.
And
Got it.
pre-jowl sulcus, as I mentioned, it is the where the marionette lines end. That is the pre-jowl sulcus.
Yeah.
So these are the points. So C1, this is how you place. C1 is the labiomental crease. C6. C3 is a danger zone because the artery is there. Mental artery is coming out, from the mental foramen down below. And here you can see the alignment of C2 and C4. So if you want to elongate the chin, vertical height, if you want to add, so C4 is the point. And if anterior projection you are looking for, then C2 along with C3 is the point.
Yeah.
Like this. And C3 is like they are adjacent to the midline, just very adjacent. Don't go beyond, don't go much laterally because of the mental artery. Although it's arising from the bone, but then it's coming superficial also. So just
So how far is it from midline? C3 is how far from
like
midline?
touching the midline.
It's close to midline.
Close to midline. Fine.
Yeah.
So this is how you do C1. C1 actually chin and jawline is the area where you can, the maximum I've injected it 6 to 8 ml.
Oh.
Right? That too with a cannula. So with the cannula, a lot of product can be placed inside because a lot of volume deficit is there. So always preferably, like if you're falling short of filler, like if you have only 1 or 2 ml, then needle is a preferred, way of injection. So C1 you enter from the lateral aspect of you mark the labiomental crease and enter from the lateral aspect till when your needle reaches the midpoint, then you start injecting and withdraw and keep injecting. So retrograde linear is the way to inject C1.
Yes.
Right. And just beneath the crease you have to inject you can maximum is 0.3 to 0.5. And this opens up the crease, labiomental angle. It opens up the labiomental angle. And the moment you inject this, the lower lip, it also improves the appearance of the lower lip.
Are you using Voluma for this?
Yeah, Voluma. Now they have Volux also, which is even sturdier than Voluma. But again, cost issues and all. So although Volux stays for long, and also after 24 hours, it is very difficult to mold the product, Volux.
Are you using Volux or not?
Very rare, not much. I'm like comfortable with Voluma only.
Fine.
Plus Volux is like something very expensive.
Okay, yeah.
So it's not practical in this part of the country. But
Yeah.
ideally, if you have a good clientage, then Volux is something which can give good results. But Volux is very unforgiving. Once injected, you cannot move it.
Fine, yeah.
So this is C1, you inject from the eye, both the sides, laterally you enter. C2 is you always, pinch the chin. Pinch the chin and then inject anteriorly. C2
So
is
I think C2 we should be going perpendicular, but here we are going like from below up.
C2,
I
no?
thought we'll go right. C2, yes.
C2.
What is the angle of the needle here?
Anteriorly, The needle should be
At 90 degree now?
No, not 90 degree, 45 degrees.
45 degree.
Yeah.
And we're in the subacute plane?
No, this is on the bone. C2 is on the bone. C1 is subacute. C2 is
Okay.
on the bone.
Okay, fine.
C3 is anteriorly you need to inject. But this is again subacute. C3. Never on the bone. See, most of the points where arteries are emerging out, we are injecting subacute. So if the artery is at the depth of the bone, the point is subacute. If the artery is superficial, the point is bone.
Yeah. So why do we go at a bone at C2?
That we have to create structure, no? Wherever we want to create structure, it has to be the bone. Wherever we are wanting to, fill something or volumize, then it is subacute.
And how much in C2 and C3?
That we will coming with 0.3 to 0.5 is minimum. Usually 0.5,
Fine.
C3 is 0.2 to 0.3. C2 and C4 is 0.5, 0.5.
C3 is 0.5?
No, C3. Subacute is like, 0.3 somewhere around 0.3. But C2, if it's on the bone, then maximum you can 0.3 to 0.5. Maximum is 0.5. With cannula, it's even more.
Fine. So C2 0.5 and C3 is 0.3.
Yeah, 0.2 to 0.3 in that range. Then C4 again, for injecting C4, you need to ask them to lift their head because you need to, hit the lower border of the mandible. Like this, right? C5 also, like it is on the bone. C6 also on the bone.
So I think except for C1 and C3, rest are on the bone?
On the bone.
Except for C1 and C3?
Yes. So this is the C1 labiomental crease. We can use Voluma or Volift, 0.5 to 1 ml. Minimum is 0.5, maximum is 1 ml. So I think 1 ml you can easily inject in C1. 0.5 here, 0.5 here. The device is needle.
Yes.
Delivery is linear retrograde, or you can do fanning also, depends on the width of the fold. It is subcute, and it reduces the protrusion of the lower lip also. That's why I said when you do C1, you'll see improvement in the lower lip also. It will give support to the oral commissure and elongates the chin. This will open up the angle like this. And if you can do Mentalis injections with Botox along with C1, it gives great results.
Yes. So when you want to give this Botox here to the depressor oris, anguli oris, where is your exact spot? You are just medial to this line, which have been drawn dotted line.
Yeah, it
in
is
continuation with the merit.
You ask the person to do like this. You
Here,
make the DO action. This is the muscle. Inject superficially over 2 units, raising a bleb.
near the commissure,
No, midline between the jawline and commissure.
midline. And you are medial to marionette line?
Yeah, slightly medial.
The 2 units, I think 2 units.
Yeah, 2 units.
And we raise the bleb. We raise the bleb.
Superficial. Because all the muscles are facial expressions, they're superficial.
I was taught that we give it just below at the angle of the mandible for DOA, or you think midway is better?
No, midway is better.
Midway better. Okay.
Yeah. Midway. Right, so C1, it will give support to the oral commissure also, and elongates the chin also, and it reduces the protrusion of the lower lip. The 3 things it will be, helping with. So that's how you inject with cannula and with needle. Cannula, a lot of product goes into this. Cannula is also a good approach. The entry point for needle and cannula is the same. But cannula is like you can, capture the entire length of the labiomental crease from one entry point only, either side. Either you enter from the right or from the left. With needle, you need to be entering from either sides, both sides.
Yeah.
But with cannula, product control, delivery control, and the depth is good as compared to cannula. With cannula, you go deep and then more product for the same result.
Yeah.
So this is C2, which is the chin apex. That's how you do anteriorly, 45 degree. Volume is 0.2 to 0.4 voluma with a needle bolus on the bone. And this will improve the vertical dimension or the chin height. Fine?
Yeah. Bolus.
Yeah. Then the C3 point, which is the, both sides, either sides of the midline. The product is again Voluma, 0.2 to 0.4. Device is needle, delivery is bolus. The structure here they mention is bone, but usually it is subcute only, because if you hit the bone over here, then it is just, you're very likely to hit the artery, mental artery.
Yeah.
So subcute.
Fine.
And if at all you can reach the bone, if it is a slim face, if it is a face which is not having a lot of fat, then you can obviously do it on the bone, but make sure you aspirate, because this is a danger zone then if you're on the bone.
Yeah.
Fine. So this will improve the anterior projection of the chin. So if you're increasing the height of the chin, you need to increase the anterior projection also. Because chin is we have to, give the enhancement in 3 dimensions. If we just keep working on the height without giving volume and projection, so it will become a witch-like chin.
So for the height, C4 is the point.
Yes, C4.
And for projection, C2 and C3 and C3 are the points.
Anterior projection and
So we need to work on all. Suppose we want to increase the height. Do we eject equal amount in C4, C2, and C3?
If you want to increase the height, then how do I go about is, first I do C1, then I do C4, then I will do C5, And then whatever product is left, I'll do C2 and C3.
Okay, so why do you do C4? Because you want to define the chin
Yeah, because see,
laterally.
some people are not able, they are just buying 1 ml or 2 ml only. So then I need to place the product strategically. So the important
Yeah,
part, which will add the length, and also the requirement of the face. If the height of the chin is more deficient, then I'll do the way I've just told. But if length is fine, but projection is more deficient, then I will do less in, this thing C4 and the pre-jowl, and I'll do more on the C2 and C3 aspect.
yeah. So the
Work,
C5 point defines the chin. It gives the shape to the chin, I suppose.
yeah, it
Uh, is
it's
it?
totality you're working. Chin is not one point.
Okay.
Right? If it is one point, then it looks like witch-like. So in men, it is U shape, and in women, it is slightly V. It's a combination of V and U. It's not exactly V.
Can we do a fanning from C5 to C4?
C5 to C4 fanning.
Yeah, to define the chin,
You can,
chin border.
but if you have that much product, otherwise just placing it on the bone is sufficient.
Sufficient. Okay, fine.
Fanning will dissipate the product. It will
It
uh,
will not define it.
define it.
Okay,
Won't
and we
show.
should keep in mind that in men we have to form a U shape and females we have to form a V shape,
Yes, yes.
oval.
Then another thing
Okay,
is some people have the crease over this thing, no, what they call,
dimple,
the dimple, and they like it.
cleft,
Yes, the cleft.
cleft.
They like it. They don't want to get rid of it. So if you do filler, you will just remove it. So you have to ask. So if they like it, then the only option is then you need to slightly change your injection points. They want an increase in the height of the chin, but at the same time, they don't want to get rid of that dimple. So in that case, C4 is the point. Then you
Got
need
it.
to avoid C2 altogether.
Yeah, sometimes I know we create dimples in the cheek. I know how to do that. But I know some people demand to create a dimple in the chin also.
Okay.
Do you know how they do it or how it is done?
No,
Because I am not aware what is the technique to create a dimple in the chin. I am aware of the technique dimple in the cheek.
uh,
One or two patients came to me with this. They wanted a dimple in the chin. I
no.
was very surprised. There is something like that. I think they mean cleft by dimple, or
They
I don't know what they
mean
mean.
that dimple only. I'll have to look up to. I have no idea about this. How to create a dimple in the chin.
Yeah, fine, fine.
Fine. So this is the C3 point.
Yeah,
Again, that's how you inject with a needle and a cannula. Cannula you can go from above also. Cannula is at the ease with which you can operate it. The point is to be
yeah,
same. Either you enter from above or below. It is how easy and convenient it is for you.
yeah.
Then we have C4, which is the submental. Again, product of choice Voluma, 0.2 to 0.4 ml, bolus. Delivery is on the bone always. Here they've written subcute, but subcute is when you use a cannula.
Okay.
Otherwise, with needle, it's always on the bone. So it enhances C2 and C3 further and improves vertical dimension, anterior projection, and rotates the chin upwards. This point. Fine.
Yeah.
Then this is the C5, lower lateral chin. Again, Voluma 0.2 to 0.4 needle on the bone bolus. It will widen the chin and gives lateral support, producing a more square chin, which is ideal for men, for C5. In women, we can omit C5 at times, It's not required sometimes.
So in female, do we give C5 or not?
If it is required, Otherwise, most of the, suppose if you're doing my chin, I don't think C5 is required. C6 would be
And
sufficient.
are you, yeah, you are on the bone. So are you on the underside of the bone, or you are like on the exact on the Like in the line with C2?
No.
Yeah, in
Yeah,
line
in
with
aligning
C2,
in
or you are in
C2.
line with C4?
C2. C2.
C2. C2.
Because
Okay.
when you see the mandible, the edges are like coming like this, you know.
Yeah. So we're in line with C2.
We are in line with C2. C6, it reduces the prominence of the pre-jowl sulcus. It is the pre-jowl sulcus, the depression before, the depression just in front of the pre-jowl sulcus. This is what we are trying to fill and camouflage when we are injecting C6. So this is with Voluma again, it can be 0.1 to 0.5. You can, C6 again is a region, it's not 1 point. So you can inject 2-3 points also. Boluses on the bone. If you're using cannula, then it could be fanning also. But again, a lot of product goes into this. So needle is the best way. And it reduces the prominence of the pre-jowl sulcus. It aligns the pre-jowl sulcus to the chin.
Yeah. So I'm saying that most of the places, it is between 0.2 to 0.4 ml in the chin that we are using.
Yeah. This is with a needle. With cannula, it is 0.5.
Yeah. Yeah. Except for C1, where we can go up to 1 ml.
Yeah. Yeah.
So C1 we can go more, but most other places we are up to
0.2 to 0.4.
0.2 to 0.4 ml, you know, and yeah. And I think C6 we don't put much.
C6 not
Small
much.
bolus.
But then C6, it can be linear threading also if it is, this much length. It could be linear threading also. But in here also, you can, 0.5 to 1 ml can be easily accommodated at this point. But again, as I said, not anybody will, we don't get many patients who will buy more than 2 ml or 3 ml. So then you need to strategize your points accordingly.
So average in a female chin, how much ml filler are you using? And in a male chin, how much are you using? Average.
2 ml.
2 ml.
2 ml. This is the minimum I use. And maximum that I've gone up to is like 8 ml. But
8 ml.
that is not average.
Fine. 2 ml. Okay, fine.
So this is the pre-jowl sulcus with the needle and the cannula. So when you're doing cannula, you pinch so that the product is not displaced here and there. You pinch, and then in between the pinch, you can move your cannula. So the 5 point, if the meeting ends, then I'll share another link.
Fine, thank you.
5 point jawline V shape. So in this, we have first is JW1. This is angle of the mandible. This. JW2 is the area, preauricular area. JW3 is the mandibular body. JW4 is again pre-jowl sulcus, and JW5 is chin apex. So when we are doing only jawline without the chin, then JW4 and JW5, right? And so JW4 is same as C6, and JW5 is same as C2. Right? So when you're doing chin and jawline together, then these points overlap.
Yeah.
But if you're doing in isolation, then you do it separately.